So, restoring the edentulous arch. Implant restorative dentistry, we're dealing with one implant or kind of one missing tooth, maybe a couple of missing teeth. We're really looking at restoring an edentulous space. In this workshop, restoring the edentulous arch, we're looking at cases where there aren't any teeth at all. So patients that are already edentulous or patients who are soon to be edentulous. How do you make the decision to extract someone's remaining teeth? How do you develop a tooth position? How do you go through a systematic approach to the treatment planning of a failing dentition versus, a patient that doesn't have any teeth? You've got no reference now for where the teeth need to go. And then how do you figure out how you're going to treat that case? And we've got a lot of options for dealing with edentulous patients. On one hand, complete conventional dentures, all the way to really sophisticated metal ceramic restorations. How do you navigate that whole world? How do you work with surgeons? How do you work with your technician? How do we begin to figure out a treatment plan for those types of patients? It's really a departure from a lot of the other stuff that we've got on campus, and I'm super excited to finally have this kind of filling out our curriculum. So what I think participants will get from this workshop is really a fundamental understanding of complete conventional dentures, something that lots of us learned in dental school, and yet newer, more recent graduates may not have done as much as somebody who graduated from a dental school program even 10 years ago. So we want to create a solid fundamental understanding of the conventional workflow, and then we build some of the newer, more modern implant-related restorations on top of that. So most people today are familiar with something like a two-implant overdenture using locators. In this workshop, we're trying to expand on that and look at all the other different types of overdentures that we could use and when we would want to use them, why one might be advantageous compared to another. How do we determine if we want to use an overdenture versus a fixed prosthesis? And if we are going to use fixed, how many implants do we need? Where do they go? What kind of materials are we going to use? How are we going to stage the case or sequence the case? All those kinds of things go into how you're going to get paid for it. So understanding kind of the beginning stages, the crawling, the walking, the running through all this stuff, it's awesome.
So the course library at Spear is it's an amazing resource that I've implemented from the very beginning. So if I go to a workshop and I learn techniques, sometimes it may be many months. It'll be months before I'm able to implement what I learned, and it's so convenient to have to be able to go back to the library and find a technique that I was taught here and then reinforce what I learned and then be able to apply it to a patient.